Peace be upon you and God's mercy and blessings. Today, I will talk about 10 important points from my personal perspective. I have selected 10 very important points for any doctor working in the ICU or outside the ICU. These 10 points were chosen based on personal experience. I encounter them often, and I believe it would be beneficial to share them with you. You might benefit from one or two of these points. It's not necessary to take all 10. Even if you come away with just one or two useful things, that would be a good thing. The first point is, don't call someone doctor. That might sound a bit strange, right? Of course, you see this happen. But most of these things have some psychological implications, especially this point. I'm talking to you about this from its psychological significance. When you call someone doctor, it has a psychological meaning for you. Why do you say that? The thing is, we often say these things unconsciously. Be aware of that. You might not even realize why you're saying it. I'm trying to point this out because I'm a bit interested in the psychological aspect. I'm just trying to analyze this psychologically and share my thoughts with you. My analysis, by the way, doesn't have to be completely accurate. It's just an effort that could be right or wrong. It might hit the mark or miss. Now, if you look at the word doctor, you'll find it's an indefinite noun. Indefinite means there's no alif and lam. In Arabic, al is the definite article. And without alif and lam, the word is indefinite, like tree, house, room, anything like that. It's a general word, an indefinite noun. So when you use it with someone, what does it mean? It means you're really diminishing them, at least from your perspective. Honestly, that's what indefinite means. Psychologically, it can't be understood any other way. And by the way, this word actually came from certain groups, from certain ideologies. Let's say there are some groups that have a particular ideology. This word is the one they came up with because you see, you're dealing with a colleague, not a friend. Because if it were a friend, what would you do? You'd call them by their name. But let's say he's just a colleague, simply a colleague. So as long as he's just that. Of course, if he's above you in rank, you wouldn't be able to use this word with him unless you wanted to belittle him. So usually you'd call him Dr. So-and-so. So if you want to say doctor, you have to follow it with the name to remove the harshness of the indefinite form. And when you add the name, you've made it specific, but usually you say it to someone below you or of lower status to imply that you're better than them. Should you do that? No, from the perspective of collegiality and humanity, you shouldn't belittle anyone. So what's the solution? Now, the solution is to do one of two things. Either you call this person by his name, considering that he is equal to you in the same position. Or if he addresses you, you respond by calling him by his name. Call him Mohammed, Hussein, Fadi, Allah, or anyone else, just by their name. Just the name. No need for any other additions. Or you can call him Dr. So-and-so. If you want to follow the people who say Dr. So-and-so, even for younger people, it means things are a bit more official. It means people aren't removing the barriers. Like, yes, I'm treating you with respect and everything, and I'm calling you by your name, Dr. So-and-so. So it means the barriers between them aren't being broken down. All right, fine. If that's what you want, there's no problem. But don't belittle him by saying, Doctor, doctor. That's not nice. The next point is, in general, you usually have patients. Patients who are undergoing procedures, wherever it may be, whatever the type, even if you're just putting something on or doing anything at all. Keep in mind that this can have a big impact. Maybe people don't notice it, but you do see it. You check his condition and so on, and then you say you want to do something for him, so you ask, excuse me, I want to do this, and that's it. For you, it's just routine. What's the big deal? Everyone does it. But be careful, because after you leave or after it's over, the patient, and then the stress of doing the echo, keep in mind that the echo, the procedure, or the ultrasound can affect the clinical condition. So be careful. Why? Because the patient might already be a bit unwell. So if the procedure isn't necessary, you should hold off. And if he's stable, leave it until he becomes stable. And if the procedure is absolutely necessary, then go ahead, leave it to God. But pay attention to this point. When you give the patient nasal cannula or CPAP, you need to be careful about the numbers. Just a simple word about the flow rate. With a cannula, don't give a flow of less than 2 liters. This whole 1 liter thing, it's not good, really not good at all. Because as we said, the normal flow is actually, if it's 6 or whatever, it can take more than 1 liter of flow, maybe 1.6, according to what's written in the books. So don't give less than that. That's it. As for CPAP, just don't use a low setting. Basically, you can set it to 6 or 7 or do whatever you want. I won't give you a specific number, but don't set it to 5.5 or 6.5. Because that's not good, since it has a psychological implication. You shouldn't think of setting it to 6.5. The important point after that is that you'll encounter some issues with certain things in patients. If something shows up, they'll tell you that the patient has a few reports, or that they did a simple test or something minor. We found a few extra little things like these. Of course, the psychological implication here is that your psychological reaction is like, just let it go, it's almost over, just a few more hours, and everyone will come in tomorrow morning fresh and ready, and they'll check if there's anything wrong. So you might think, if I just let it slide, no one will notice. But be careful, because if something like this happens and it develops later on, if something significant happens, we'll go back to what started the problem in the first place, and not just that. The point isn't. It's not about an investigation or us interrogating you or saying that you neglected something. The idea is about the patient, as patient care. It's a human being with a problem, and you have all the tools to try to solve that problem for them. Fix these things, make up for them. If you notice these small things about yourself, mentally tell yourself, no, there's something psychological here that I want to get rid of. Even if you feel like you just want to get through the minor things so you can move on to the core work, don't do that. Take everything seriously and give it the attention it deserves. Do what needs to be done. If you find that a patient has tachycardia, you might say it's because they moved a little or come up with any excuse. But no, if you really understand it well, it could be a sign of sepsis, or it could be that the patient has some other illness. If you go and check on them when they're in pain and you pay attention to the issue, you'll realize that clinical management will make a difference. The next point is about postponement, about delaying things. How does this happen? A patient comes to you and needs a certain procedure, but you say, okay, let's just wait until everyone is done eating, and then whoever comes next will do the procedure. You start making excuses for yourself, psychological excuses, really. You say things like, no, I was busy, I was doing something else, or there was a problem with another patient, so I got caught up with them, and so on. What I want to tell you is, yes, people do understand. The people around you, your colleagues, and everyone else, they pick up on your attitude. It shows. I mean, it becomes obvious that you're postponing things and putting things off. And this affects the person coming after you, whether it's in the morning or someone taking over from you during a call or at any other time. It becomes clear whether you care and do your job well, or if you're just saying anything to put off the work for the next person after you. So don't procrastinate, even for the sake of those who care, and for your own sake, as we said before, so you can do your job well for yourself, and for the sake of those who care. Because the person who cares and needs this thing, when you actually do it, it's definitely better for you to move on to the next point. Never be embarrassed to say, I don't know. By the way, this has a strong psychological significance. It shows maturity and that you really know what you're doing, because most people who truly understand things well are the ones who say, I don't know. And of course, I don't want to talk too much about a topic we've already discussed before in the time when we talked about don't be ignorant and don't be a criminal. I hope it was a useful topic and a good one. You should listen to it. I mean, it's really worth listening to from a theoretical perspective. It's a good thing. It carries a message. So people who really understand say, I'm not pretending, and without any embarrassment, they don't act. What does that mean? It means you might come to do something like perform a certain task and say, no, I can't see, or I'm not pretending. Or you might be doing something and it's not working out for you, so you say, no, I'm just not able to do it. And it's something easy. I mean, the problem is, where does the embarrassment come from? It comes when the task is easy. So when something is easy, we feel embarrassed that we can't do it, especially since it's very simple. But no, not at all. It's totally normal. For any reason, sometimes this red reflex thing, because your vision might be very different, you might be wearing glasses or your eyesight strength or whatever the reason, sometimes it's just like that for certain things. For example, sometimes the glasses you're wearing have anti-reflection coating, which prevents you from seeing this red reflex. So don't get embarrassed, don't get flustered, because this will give the impression that you are well educated, knowledgeable, and a mature person who isn't ashamed to admit what they know. And this is one of the qualities of scholars. The second point is whoever is with you, whether it's about those topics, even if you're a subject lead, a manager, or higher or lower than that, you'll always find someone with you who knows less. Even if you're a subject lead, you'll have an intern with you, for example, or even if you're alone, you might have a child with you, or if you're a doctor by yourself, you'll have siblings with you. So teach them something. This is an important point, by the way, because most people get rigid and say there's no one at all, but take it as a principle. There's always someone, even if it's just a simple piece of information, something small like that. But if you do all of this, you'll find yourself benefiting others, and that's a wonderful thing. Excuse others just as you excuse yourself, the people who are with you. Excuse those who aren't with you. Who are they? Other people, people from other hospitals, people who are in another center. You might be in a good center, a well-equipped center, and you receive cases from outside that are referred to you. So don't treat them with arrogance and don't act like they don't understand or don't know. That's not how it is at all. I want you to be aware of a psychological aspect within yourself to understand it so you don't act on it. When we're in a stronger position, we tend to look down on others. There's a psychological effect like that, and we do it unintentionally. It's something subconscious. But if you become aware of it, you might become more humble and you'll find others. For example, someone working in a primary or secondary hospital, naturally, their experience is limited, and that doesn't mean that just because their experience is limited, it doesn't mean they're not good at their job or don't belong in that place. The cases they see are usually simple and the resources are limited, so they haven't dealt with certain things. So when a complicated case comes in, they need to refer it. You should accept that from them. It's completely normal. Your position in a tertiary center means that these difficult cases are supposed to be handled there, so it's not something unusual and it's not really an advantage for you. It doesn't mean you know more just because you're in a bigger place. So it doesn't mean that you're someone important or anything like that. And it doesn't mean that he's not important either. It's a matter of levels and relativity. You might be important in your place, but there could be someone else in a bigger place doing harder things, so you'd be a bit less important. So we shouldn't look at it as more or less. Just stay humble with others you deal with and don't rejoice in other people's mistakes. There's an English saying, I'm not sure if it's accurate or not, that says, you feel happy. When you see others in a bad situation, this is a psychological phenomenon, and maybe we all feel this way. You feel safe when you have a problem in a certain place, and then someone else has a problem too, so you feel like you're okay. If nothing bad happens to you, sometimes you feel relieved. So if you pay attention to this point and understand its psychological analysis, don't be too happy about it. There's no reason to be happy because you could simply end up in the same situation yourself, maybe next time, in the future, or at any moment. So if you find yourself feeling happy about it, I don't want to say you're gloating. I don't want to take it that far because in the end, the mistake that happened to someone else, well, it's not good. You shouldn't wish anything bad to happen to any patient. If you pay attention to your own psychological state, you'll realize, no, I'm just like them. And if it didn't happen to me now, or it happened to a colleague, it could happen to me at any other time. The last thing and the nicest, kindest, and most important thing about this is that when you're in the hospital, whether for a long time or not, at some point you'll find yourself with some free time. Don't tell me you're working and busy 24 hours a day and never have a moment to do anything else. You'll find a few minutes, 10 minutes, that's it, just 10 minutes, maybe 15, maybe half an hour. So you could use that time for exercise. Just a piece of advice. It might sound a bit odd, like I'm suddenly talking about public health, but it's a principle. I actually discovered and learned it from others, just to give credit where it's due. If you find yourself with some free time during your hospital shift, You can use it to exercise, because exercise is really important. It's very important for you, especially as you start to get older. So you'll find that the earlier you start, the better it is. Why should you do this? Why use that 15 minutes to exercise? What kind of exercise? I'm not telling you to jump around or anything like that. Just go up and down the stairs. Look at the place you're in. What is it like? Yeah, you'll definitely find a building, anywhere really, where you can do this, but you'll always find stairs somewhere. Take 15 minutes, and if you can add a bit more time, that's even better. Go up and down the stairs. It depends on how many floors there are. Divide the floors according to the time you have available. 15 minutes or a third of an hour or even half an hour, you'll find it beneficial, especially if it becomes a habit. I want you to make it the principle. Tell yourself, in every call, I'll spend this half hour going up and down the stairs. Why the stairs? Because no one will notice anything. You're just going up and down doing something, so you won't look crazy or anything. You're doing it smartly, like you're just going up the stairs normally, then coming back down. But you don't have to go down all at once. You can do something, then come back down, do something else, then go back up again, and so on. Do it for a bit, depending on the time you have. You'll find it's really useful. It'll energize you, and it'll set an important principle in your life, because usually in your other life outside, after you leave the call and go, you end up tired and you don't feel like doing anything, not even walking, going up, or moving around. So it's useful in those moments when you find yourself with some free time during the call, or even while you're there attending a regular morning duty. You'll find a bit of time around noon. You could spend half an hour practicing during that time. Afterwards, the exercise will be beneficial for you in the future. You'll realize its value later on, especially considering how nowadays we're seeing people experiencing cardiac arrest, collapse, and other issues. People are getting clots and all sorts of things, so take care of your health. Those were 10 points, I believe. They're a bit different, but I hope they're at least somewhat useful, even if not all of them. Maybe one or two will be helpful. With them, we might have delivered the message we came here for. Thank you. And we'll start with the meeting in the meeting in the meeting.